Great.
In this general area, we get to the cameras. How are we doing for time? You're sorry.
So I have speakers that'll hold up. Just
Hurry
to let
up.
you guys know.
Kind of thing.
How about like Mayday, Mayday?
That's right. Okay, cool. And did you say you're going to introduce us? Nice.
Oh, yeah.
Very classy place you're on here. Like it. Cool. Right now it looks like the Janet show. Since you're doing it on Zoom, Janet.
Really? Cool. I do see that Carolyn is on here.
Nice. Sure. Right? Yeah. Your clip?
Simulation demo. Ready?
Okay.
If you'd like to, but people might shuffle in and out, so whatever you want. Good afternoon, everyone. My name is Mariah. I'm part of the Hatch planning team as a student assistant. I will be monitoring our time today. Just so that you guys know, the session will be recorded for future use. It's my pleasure to introduce Janet Vizini-Roubal on Zoom and Carrie Thompson and Michael Berghoef.
Thank you very much. Welcome, everybody. Glad you could join us today. We're going to be talking about our experience this last year with using simulation in our Masters of Social Work classrooms. And I am Mike Berghoef. I'm the chair of the Social Work Department.
Carrie Thompson, I'm the Bachelor's of Social Work, the program director.
Hi, and I am joining you via Zoom all the way from Traverse City, and I am Dr. Janet Vizini-Roubal, and I'm the MSW program director. And we do have a question in the chat. I'm not sure. Carolyn Sotheby can't hear anything. Oh, never mind. She got it, she said.
Excellent.
Okay.
All right. Thanks very much. And so there we are, introductions. And so a little bit of background on this project. This is something that we've talked about for many years. We knew that there were simulation products out there. We had never purchased one or rented one, but we knew that our colleagues around the country had been using simulations for a variety of reasons that we'll talk about in a little bit. The pandemic sort of gave us an opportunity in that people were getting used to this kind of delivery of social services, of especially psychotherapy services, in an online format and a video conference format, interacting with people on a screen, something else that we've been talking about for a long time. The pandemic just kind of pushed us a little quicker into that. And what this really did was it gave us a chance to practice specific skills. And the idea behind this is that we've tried different things in the past. Traditionally, social work, especially advanced social work, clinical classrooms, make use of kind of partnering up with classmates in the classroom in a role play sort of way. And there are some limitations to that. It tends to be one of two things. It tends to either not be very realistic because you're kind of pretending to have a certain issue that you're presenting, or it tends to be kind of oversimplistic and not very serious. So Sometimes in our interviewing, in our therapy classrooms, we'll ask folks to take an issue that's not incredibly difficult, maybe something like a roommate hassle or something like that, or maybe test anxiety, something that's fairly benign and not very deep. The other way that folks have done this around the country is to hire actors to actually portray more challenging situations, things like suicide assessment, working with people with depression. So I've listed a couple of the reasons that this is a limited approach. And one of the ideas is that it's just not a very realistic situation, right? If you're playing at being suicidal, you're playing at being depressed, it's kind of hard to take your classmates seriously when they're doing that. And it almost borders on disrespect, right? Those are serious issues that we want our students to take seriously. Role playing them in kind of a almost goofy classroom situation can sometimes seem and feel disrespectful. And we've gotten that feedback from students. It also kind of limits how severe the issues are that you can address. Things like aggressive clients. This is something that we've gotten feedback from our alumni saying we really need more practice before we get out in the field with highly aggressive clients, with clients that are dealing with serious addiction problems, serious depression. And issues of privacy, again, with students sharing their own, if they ever share realistic issues that they're going through themselves, then it becomes a boundary issue with how serious of an issue is appropriate for a classroom situation. And then finally, the idea of objectivity, that it's hard to give objective feedback if you are an actor, if you're observing someone with an actor, an instructor observing someone with an actor, or in a role play situation with a classmate. So some of these are the ideas, some of the reasons, the rationale that we used for actually going forward with the simulation.
And just as a side note, Jason, is this on? Is this okay? I wondered about that. Oh,
Now you can.
my the green light.
Flashing.
Okay.
Beautiful, thanks.
No, I was just going to add what Mike said about the interviewing is a big part of both our BSW and our MSW program. So we introduce students to interviewing. We have 2 interviewing courses in the BSW program, and then a lot of them go on to clinical MSW programs where it's not only interviewing, it's practicing clinical skills. And so what we found in a lot of these interviewing classes, kind of what Mike said, over and over again, we had these relatively benign situations that kept coming up between these partners that were in these labs, class after class. And so,
Yeah, just generally not challenging enough. All right.
So this next slide is my slide, and I'm going to talk a little bit about the 2 modules that we utilized and why we used them. We did start this project with offering them in 2 courses, actually 3 courses. Our beginning kind of interviewing course, it's called Social Work 530, our beginning graduate level course, and then our advanced clinical course as well. And then I had a few licenses left over that I could offer it to our first year graduate level internship folks. There were 4 students that wanted to kind of test it out and see if they liked it or not, and they could use it in their internships when they had some downtime to actually practice some. So those are the 3 courses we did it. So 2 different levels of students, but we wanted to kind of see how they did and which level would be in the end be like most appropriate in which class. So we chose the suicide assessment, it's prevention and treatment planning. I'll talk about that one first. I think for pretty obvious reasons that it is very hard to find, like, to have a role play when it comes to someone who needs like a suicide assessment. Most students are getting real life experience with this in their internships, and then they're coming back and saying, oh my gosh, I didn't know how to handle that. They were nervous, they struggled. They also had some maybe physiological impacts of nervousness, not, just not aware of how they would respond to clients who had some suicidal ideation. And so by doing a simulation, they're getting some real live feedback and some real live situations where they can practice and they can practice and they can practice. And they are not utilizing other students as role plays. That could be very triggering, as Mike mentioned. It can be very triggering for someone to pretend to be suicidal. And so they can practice and practice and practice, and also it can desensitize them to maybe some things that are going on with themselves. And making mistakes was okay when you're in a simulation. It's not going to hurt anybody. And so that's, the big reason for choosing that. So then we found where we're hoping to find out, and we've done some pre-surveys, post-surveys, and we're going to do some focus groups this spring and also interview faculty that utilized it to kind of hopefully get a big picture of if they this worked really well or not, if they're finding that they're learning a lot, they're getting more experience and all that. So that's the reason for the suicide assessment, prevention, and treatment planning. We also decided on the cognitive behavioral therapy, mainly because this type of evidence-based therapy is pretty well known and well utilized. And we were getting feedback from students that just wanted more practice with it. They wanted to learn more, they wanted to get more information about it and just do a lot more practice with it. So that's kind of the reasons we did that. So typically we wouldn't do much intense work with cognitive behavioral therapy in the first year students, but with this, they are getting some more intensive work with it. So it should be interesting if they get further along ahead in their advanced clinical than maybe other students who didn't have that. So that's something that we're looking at as well. So that would be the two modules utilized. Do you guys have anything else to add, Mike or Carrie, about that?
No, good. Let's move on to maybe a little bit of demo here.
So Jason, if you could. Yeah, I don't know.
I just didn't hear you.
It was off, yeah. Yeah, that would be great. So we thought it would probably be most beneficial just to kind of get you into the program a little bit and to see how it is laid out. Jason's going to pull that up. And what I'm going to do, I was going to pass out, I went through this last week, went through one of the modules and got some feedback. And I just thought it would be interesting for you guys to kind of see the feedback that I received. So Jason, if you want to go to the Tanisha, yeah, this is the one that so we're going to kind of start kind of in the middle. It can be, yeah, it asks you what kind of voice you want female is fine. So Tanisha is the client in this simulation. It starts with kind of just an overview of CBT a little bit. You can go to next. Is that what it says? Yeah, it just talks about how to navigate. That's fine. You can go to next. So this is where it kind of starts into the actual simulation. So again, Tanisha's the client. I think this one is kind of starting where I left off. Sorry, I can't.
Sure.
Sorry, I gotta get a different angle here so I can read. And I'm gonna pass these out too. Yeah, that'd be great. So I know it's a little bit difficult to read. I expected that to be a little bit bigger. But this is the conversation that you're having with Tanisha. This little avatar kind of in the corner here is, she's telling you, once you pick one of your responses, she'll tell you, you did pretty good, or that was a good response, or not such a great response, that sort of thing. So Jason, why don't we just start with picking one of the blue ones up there, and it will just kind of continue up right here, like this follow on. Yes. Was that not working? Try next. I'm sorry, maybe I'm not enough screens in. No. The score history is where I was before. Sorry, I can't read all of it at one time. You can close that one, Jason. Yeah, why don't we try C here a minute? Oh, sorry. Maybe X out of that. I'm just trying to get it to play. Try the, go back to the instructions maybe. Yeah, okay, yeah, maybe try that, Jason, sorry. Yeah, yep. And then just push don't save. Because I think it started in the middle of where of course it's not. Okay, try save. Oh, nothing. That is weird. Okay, hit close. And just try next. Let's see if that'll take us back to just our talk tab. Goodness. Go back to the instructions there a minute. Wait, yeah, just take us back to the home maybe.
Hey,
Try that
Carrie.
talk-
Carrie,
talking
try
with-
talking with Tanisha. Click on that. Here you go. And then hit play.
Try the play there.
Hi, I'm Tanisha Mosley. I'm a working mom with a husband who doesn't get it. When I was home full time, I did everything around the house, and that made sense. It was my job. Then he decided it was time for me to go back to work, but he still expects me to do everything. It's too much, and he won't listen. So sometimes I drink. It started with a glass of wine when I got home from work, but now something has to change. So I'm here talking to you. It's your job to tell me about CBT and how we can use it to help me change my drinking, and maybe how I relate to my husband. Each time you talk with me, think of me as a new person. While I'll always be Tanisha and my background will always be the same, my reaction to CBT will change each time you talk with me, so you can gain practice talking with different clients.
Okay, now click on the next. So it just gives a little bit more of this background, why she came to therapy. Click on the next. I wanted to get to the page. I wonder why that won't let me go back. So it talks about, it is kind of nice because it talks about things like collaboration, your tone, your showing empathy during CBT, which is a huge piece of that. Try next again, Jason. Why will that not go?
Hey, Carrie, try where it says go to conversation in green at the top. See if that does it.
Oh, I can't see that.
Oh, there, it's right there. There you go. Then click on one of those. They were highlighted. Yep, just pick one and click on it.
Just an introduction.
Let's talk about some ways we can get you to where you want to be.
Look at the little avatar.
I guess you've got something in mind?
Yes, yeah, that's.
I do. Based on what you've told me, I'd like to talk about cognitive behavioral therapy.
That's what I'm here for, I guess.
So now, Jason, let's pick one that we don't think is great. People who want to make changes. Yes, try that one. Yeah.
Cognitive behavioral therapy tends to help people make the changes they want to their drinking
Little avatar.
because it helps us understand our patterns and identify things we want to change.
At least you didn't just pull something out of a hat.
Pick the top one there, Jason.
It's important that we have an agenda to keep us on track.
Not so great. Not so great.
Sure. Okay.
Okay. Let's pick one more and then we'll, yeah, you can pick any of them. It doesn't matter.
So you understand what we will be doing together, I'd like to explain a little about CBT and illustrate how it works.
Okay.
So you can really go down the bunny trail with this, right? I messed around with it for about 30 minutes a couple weeks ago and got that little printout. But you can go as far into this. I mean, these simulations can last over an hour. And it is nice because you get the immediate feedback. Like right away, you get that printout and also the instructor gets the printout, right? So it's a very safe way to practice. I was just talking to a couple of our faculty about this before this training and before this presentation. And we were talking about how, especially in regards to CBT, it gets you using the CBT language. And that's very typical for any evidence-based practice, right? There's a definite lens in which we use depending on the different evidence-based practice that we're into. And CBT, for example, when I was doing this, I'm like, oh yeah, right. I've been trained in CBT. That was 5-6 years ago. And it's like, oh yeah, that's right. That's the terms that we use. That's the views that we take. And it just kind of gets you back into it in a very methodical way, right? When you're doing this for an hour straight, after a while, you're like, yep, that's a CBT response, as opposed to getting it from an instructor or whatnot. So any questions about that? That's just kind of an overview. You could see on the first slide there, I think there were maybe 6 or 7 different modules, but all of them had to do with either CBT or suicide assessment. So those were the 2 modules that we chose that Janet talked about earlier. And then each one has 2 or 3 different clients and different situations that we can work through. Okay.
Yeah, and I'd like to say a few things. I played around a lot in the suicide assessment one and got my readout about how I did. And I also talked with my students about it, and they really liked the piece about why, their rationale, like why that was a good choice and why maybe it was a not so great choice. And sometimes some of them that they said oh, that wasn't such a great choice, but we talked about maybe there's some scenarios where it would be a good choice depending. And students actually gained, the ones that I had talked to about this, they gained some confidence, and they said that they went through it one time and they didn't do so good that the client on the screen actually walked off. And she said, I'm so glad though they walked off in this fake simulation and not in real life. I learned a lot, and now I know how that feels. And that was one of my field foundation students who's in an internship. So so far, I thought that was a cool thing that she could say that, hey, it's better to do this right now while we're playing around with it. Well, not playing around with it, but, getting this experience with a simulation rather than a real person. So.
You can go back to the slideshow. Yes, yep. The light's not on again. You might want to use this one. Yeah. See, we talked about this a little bit already, but obviously the benefits are, you can increase that feedback loop. It's almost immediate, right? The student can compare. They can do a simulation 2-3 times in a week and compare how they did each time. Did they become more comfortable? They become more confident? Definitely, like I said, the printouts are helpful, and they can keep those and look back at how they've done.
There's also some analytics that we have that we can send to it's for the instructors to use, that shows how many hours they were on the system, how well they did, how they scored for each thing. And that has been, I think, hopefully helpful to the faculty as they're looking at all the analytics for each student. So that's been helpful as well. And the bullet that said provide student success with a little embarrassment, I think is also a key thing for a few folks that are have little experience with client interaction, because they're in their own home, and they can, if they mess up, it's just between them and the screen. You know what I mean? So that has been, I think, very positive for students, in fact. No, sorry, Carrie, interrupted you. I'll let you keep going.
Oh, you're fine. I was going to say too, students come into our MSW programs at all different levels. Some of them have been in the helping profession for a lot of years, like maybe they've done work at a BSW level. Maybe they've been in a position where they've done a lot of interviewing in the past. And then we have other students who are English majors, right? Who have never really participated in an interviewing course in the past. And so I feel like this simulation project has helped to level the playing field, or at least give opportunity to level some of that out, because it provides those students with little interviewing experience opportunity to practice more if they choose to do that. And so I experiences. So Janet mentioned a safe way to practice with sensitive topics. They can't be replicated in real life. Immediate, consistent feedback, replicable client for students practice, right? So again, you can practice the same client over and over again and get better is the hope, okay?
Yeah, and the same thing with the feedback is it's a little more objective than, as professors, we're watching interviews, we're paying attention to the interviews, but it can be very subjective. This is, a little more objective. Again, it kind of levels everything out a little bit more. I like that too.
Yeah, and as we were working on this presentation, it kind of brought me back, 100 years ago when I was a beginning MSW. Thank you. I remember two of the most difficult times were, one was dealing with suicidal patients, because it just was incredibly difficult. It can't get more serious than that. And so that was always a very challenging time. So part of it is just the anxiety of approaching that situation. Again, as Janet said, you can do this, you do it over and over again in a pretty safe environment where you are getting feedback from the software at this point, and that feels very safe, as opposed to working with somebody that's actually in that situation, or somebody that's acting as if they're in that situation. And the other time that was challenging was working with clients that were severely depressed, sometimes the same clients, but depression can be very exhausting to work on. And when you're with a client that's severely depressed, it can be very energy draining for the therapist, except that depression is very treatable, and CBT is the treatment of choice. So for students to get that practice in an environment where they actually can get some positive feedback and can see what works with CBT and depression, I think it really kind of puts them just miles ahead of other ways to learn those skills. So I think it really does. It's a much more efficient way.
So next steps, I'll kind of start this out, Mike, if you don't mind finishing up. So we have not started the student focus groups yet, but we plan to do that this spring, and really ask some questions of students about how impactful this was for them, to get a good idea if this is something we need to continue or change up, if it's put in the right place in our curriculum. And along with that, we also want to talk with our faculty who used it, and what they liked, disliked, some challenges, some successes, anything that we can be gained from the students and faculty to have a good understanding of the value of it, the impact of it. And then also summarizing we did a pre-survey, post-survey, and then we also have the analytics from the software itself to kind of look at as well, that can contribute to what we should do with this moving forward.
Yeah, so we want to really get our arms around all the different ways that we're engaging in assessment around this, and kind of get as clear a picture as we can in terms of how this has helped us, how it's been useful to students. We're going to continue looking at the sort of the emerging literature around this. We're hoping to present out on this in the fall at our annual program meeting for social work educators. and contribute to the literature by publishing on this. One of our next steps is also kind of looking at our sustainability. And part of that is reviewing other programs that are out there. This isn't the only game in town. It's actually a fairly pricey software. So you lease it, right? You get a license for a semester or two, and it's in the neighborhood of $5,000 to do what we did here with the 2 modules. So we're trying to figure out what's kind of good stewardship of our resources. Who else is out there that might be providing a more competitive and more cost-efficient way of doing this? In terms of looking at those alternatives, we may find that there's a way that we can do this in a homegrown way. Ferris has a lot of these kinds of resources in-house, and we also are kind of, inching our way into the open educational resources arena. So there might be opportunities for OER with this kind of programming as well. So in terms of cost, at this point, we're sort of struggling with, is this something that we value so much that we would use department funds for it? Is it something that students may be charged fees? We're reticent to do that, of course. Or do we look for something that's more economical and or homegrown?
And I do just want to say real quick, we do have a research assistant who's been phenomenal in really parsing out the literature for us. And she already has found some research articles around submersions itself, and then also looking at other alternatives as well. So she is going to continue to help us with that and work on that with us this summer to continue on with this project.
And in a slightly different direction, might be using some of Ferris's resources in terms of virtual reality. There's potential there as well. It's not dissimilar from that, but that would be quite an undertaking.
Yeah.
Any questions of any kind? Jason?
I usually don't say anything of these, but I was in here earlier and West Thompson was doing a very similar thing. If you guys saw that, so it seems like there could be some collaboration there.
Right, kind of the choose your own adventure presentation, right?
They kind of a similar path they look like.
Yeah, had the same thought.
Yeah, there's lots of this kind of stuff out there, right? This is not really new. I mean, it's been at our APM, our annual program meetings for years that other programs are using these types of programs, but.
It tends to be kind of pricey, and there is a bit of a learning curve to it, but I always think back, there was a time when creating a web page used to be an incredibly challenging thing to do, that you need to know a lot of coding, and you just had to really have a lot of expertise. And now it's something that pretty much anyone can do in about 5 minutes, depending on what the outcome is for that. So this might be something that just becomes easier and easier, more available, and something that faculty like us could put together.
All right.
Other questions? Janet, any thoughts?
I don't have any last minute, other than we do have, I hope she doesn't mind if I put her on the spot. Carolyn is here, and she is one of the faculty members that used it this semester. I don't know if she wants to share any of her experiences with it real quick, but if she doesn't want to, I completely understand as well. I'm kind of putting her on the spot.
Oh, I don't mind being on the spot.
Okay.
I just have to figure out my camera situation here. Okay. Hi, everyone. So great presentation. And I think it really was useful to show the simulation the way you did, because I think it's hard to understand. And I found that the length of time it took to understand the program itself and navigate through it was the most frustrating for me as an instructor. So it took a lot of effort and time and energy to learn the submersion program in order to support the students. And so that was a learning curve for me, because I sort of expected, well, there's this package and students will just go through the steps and follow it. And then when I would talk about it, so how's it going with submersion? Students were like, I couldn't even start it. I didn't understand it, or I didn't get through it. And so we spent a lot of time, I think, in that aspect of navigating submersion itself, rather than kind of them being able to actually practice the skills that it was intended to. But I do know from Dr. Malone, who taught another section of the same class, her students had a very different experience and thrived at it. And so I sort of think it's probably more about a Carolyn Sotheby issue of the technology, like working through it maybe, than the students themselves. But my students were excited once they delve into it a little bit more. And they had some really positive feedback about the opportunity to have this practice, like Mike was saying, separate from a role play and in front of other students and at their own pace, and not have to worry about other students seeing them or their progression. And that just anxiety that they feel about doing role plays, that's real. And again, that the ability to hopefully take out the triggering or potential trauma from working with suicidal clients, or their own sort of trigger that happened with the students, that was eliminated. So I do think there's a lot of room to use this in our program clinically, and I'm hopeful that we can kind of work through some of the kinks and then see what else is out there.
For sure. Yeah, I agree. And yeah, Carolyn, you hit on some great points. And I do think I had that same experience every time I taught that same class of students, the anxiety of everyone in the whole class watching them do an interview, from either whether they're the client or whether they were the social worker doing the interview. There's so much anxiety around people watching them doing it. As comfortable as you can possibly get them, it's okay. You know what I mean? We're all learning. You're going to make mistakes, but still there's a lot of anxiety, where this kind of took care of that. They could practice it as much as they want. And I had in my internship class, the students who utilized it, they didn't comment on that they had any trouble, navigating it. But I also did do a little tutorial with them, so that might have helped too. But yeah, it is just a little tricky. I can see how it's like, okay, I got to really read through the instructions and figure out how to do it at first. But once you get the hang of it, and again, also looking at what else is out there. Maybe there's something different, better, a little more user-friendly that maybe we need to use instead.
Yeah, we don't want to overcommit too early when there are other products out there.
Yeah.
We'd also be remiss if we didn't give a shout out to the Ferris Foundation. That was where the initial funding came for this pilot project. And so through a very generous grant, that was how we were able to do this in the past year.
Yeah, absolutely.
If there are no other questions, thank you very much for coming, everybody. And that's a wrap. Thanks, Janet.
Okay. Sounds good. Bye.
I texted you guys a picture.
Aw.
Presenting just.
Jason, do you want